Infertility is a very tropical topic. Infertility is as a result of so many factors, and it does not really matter the number of times we will treat it on this program. This is because it occupies a very, very curious and serious issue worldwide. This is because the causative agents of infertility, both in men and women, have been devastating the entire world, and the entire world finds it difficult to handle it. And the way we handle it in Nigeria here, it looks we are like ahead of the world. I can say this is because we can take care of it in a better and faster way than the world, without incurring a lot of issues with respect to the risk of treating it. As earlier defined, in men, in women, starting with that of women, we have issues of smelly menses, dark brown menses, menses that are seized, breast that is oozing milk, a lady that produces eggs that don't have life, deformed eggs, or eggs not even produced at all, and menses disappeared. A lot of hormonal balancing issues with a woman, stunted growth in several ways. Whereas in men, we have issues of quick ejaculation, one sleeping with the wife without anything coming out of the man's system. As a result of that, no pregnancy can come up. You have issues of very, very small manhood, which is as a result of infection. You have manhood that finds it difficult to come up. And when it comes up, about the time that is required, it goes babas. So these are the critical issues. And in a more elaborate situations, as we have in women, it can lead to ovarian cysts. It can lead to all kinds of situations of endometriosis, fibroid, cyst, and hormonal imbalance and infections. Whereas in men folk, it can lead to staph infection reflected in prostate, from enlargement into prostate cancer, and what have you. Retention of urine in the bladder with some kind of infection, with the kidney retaining 75% of urine, or at varying percentages. I've decided to expand this so that the numerous questions I'm being asked every time this program is listened to can be resolved. But can we shock the world how we treat infertility in Nigeria with the use of phytomedicine, when we use our cross-ferous plants, the phytochemicals we obtain from there, have been able to resolve issues of staphylococcus, E. coli, salmonella, even Klebsiella. Of recent, a person who is on stage 4 prostate issues that was not responding to treatment was given one of the phytomedicines. And to the glory of God, the stage 4 got resolved that confused doctors in one of the states in the United States of America, despite the stage 4 no-go area with cancer. Breast cancer have been resolved, prostate resolved, and many more cancers resolved. Apart from Cuba, there's nowhere else in the world that a clear-cut cure for cancer have been announced using natural sources. Whereas Cuba has its own from the sting of a scorpion. And here in Nigeria, we have several sources of cancer cure and prevention, which has been validated by the University of Texas under experimental biology as far back as 2020, as far back as 10 years ago in the state of Texas. The phytomedicine that were obtained from Nigeria, specifically from my lab, Sulfur 6, have been analyzed and found to cure 2 cancers at a percentage from 89 to 90%, and also taking care of Staphylococcus and E. coli and Salmonella. And that is why today we have been able to resolve prostate without undergoing complicated issues of removing the entire scrotum or some form of complicated surgery.